So it really seems that medical weight loss injections have been elevated to a level of sainthood, very similar to the pandemic injections. And that means that we're not allowed to question or criticize, or we will ever so slightly be suppressed by social media. And when you read the literature, the medical published literature on these medications, it sounds like really reading a catalog for a Carnival cruise. Now, they promise you everything from losing weight to controlling your blood pressure to doing the dishes, which is certainly something that I could use. But as a physician that has a medical weight loss clinic and is not using these injections for a reason, I'm a bit worried about these statements. Because, I have seen a lot of patients that had severe side effects on these medications. And if you only have to lose 5 or 10 pounds, is it really worth to risk these side effects? And we're talking about muscle loss, Zempic phase, pancreatitis, gastroparesis, gastric paralysis, and so on. And also there is a warning about thyroid cancer. There's a black box warning, of course. Now, this has been only studied in rodent populations, but it is something that is a possible concern. So when we see something in the media that is actually critical of these medications, I think we should really listen. Now, this is something that I've talked about a few months ago, and then it was sort of swept under the carpet, in my opinion. But it kind of resurfaced. There's another study talking about this, and this is NAION, or non-arteritic anterior ischemic optic neuropathy. I hope I said that right. It is a condition that can cause blindness, at least in one eye. So the positive news, if you want the glass half full, is you still have the other eye. But of course, this is quite concerning. Now, it's been documented really mostly in people with type 2 diabetes that are taking these medications. But when we think back, isn't that the population that it was originally designed for? So again, it is concerning. There is a significant number that were affected by this. And so this was published, right? So when we take all these side effects together and this risk of this optic neuropathy, we really have to evaluate, should these medications be used for the whole population, which is certainly something that the pharmaceutical industry is pushing for. Now, in my opinion, these medications do have a role. Let's say you have someone who's morbidly obese, who has failed many other treatments and is at risk of developing heart disease, diabetes, and kidney failure, then certainly short-term treatment with injectable weight loss medications can be beneficial for this patient population. Absolutely. Now, keep in mind, this is a very small segment of the population, much too small for the pharma industry, because as any other industry, they want to broaden their patient base or their client base, right? So it's very understandable. But I think we should take a step back and say, listen, it might not be a good fit for everyone. It might be a fit for some patients, especially patients with severe obesity and severe disease. And some people might do very well on it. But there is a fairly high number of people having severe side effects. And I've seen this in my practice. So I would say, as always, we should be critical in evaluating who's a good fit for these medications and not just blindly believe the media, but also not blindly believe the medical media who are really pushing